there's a huge focus on longevity in our society today, and this is something that is a good thing. It's not anything I'm ever going to detract from, but there are certain pillars that have to be in place for that longevity to take place. And today, what we're going to talk about in this video is one of the things that recently came out that destroys your brain health faster than anything. So, obviously, having longevity is important, but we have to be able to use the things and do the things that we want to do in that time period to actually get the results. That provides the benefits of the longevity, right? So we're going to dive into what that is. We're going to dive into what you can do to minimize the impact of that or prevent that from happening. So I'm Dr. Jeff Cumro, and in our clinic, we work on ultimately building up the hardware and the software of the system. Obviously, we want the brain and the body to work as well as they possibly can. But that's not all. If you have a sports car sitting in your driveway and you don't have any fuel in it, it doesn't do you any good, right? So we also have to look at the software. We have to look at the energetic systems that supply the fuel to the brain and the body to get those optimized outcomes. And when we could do that successfully, it doesn't matter what kind of environment you get placed in. It doesn't matter if it's an environment where you're trying to learn, or a stressful environment, or one where you're trying to relax or sleep, or whatever else. Whatever the environment you're in, your brain can bring the right resources forward to actually give you the outcome that you're searching for. So, ultimately, like I said, longevity is a big focus, and there are a lot of practitioners that have jumped on the longevity bandwagon. And one of the things that I see in that longevity bandwagon is a lot of people are focusing on metabolic health. And metabolic health, like I said, is one of the things that we absolutely need. But a lot of people aren't looking at what we can do to protect our neurological health. And the neurological health is obviously a major concern. There are 6.7 million people in the US that have Alzheimer's alone. That doesn't include those with Parkinson's or other forms of dementia that basically steal the same types of things, right? They steal our experiences. That puts about 1 in 8 people at age 65 that is going to have Alzheimer's. Once people live to about 85 years, about 50% of them are going to be faced with Alzheimer's disease. And that's an astronomical number. Like, if you knew that going in, longevity is, like I said, it's a noble pursuit. We want to live longer, and we want to have better quality life while we're there. But if you know going in at 85 years old, 50-50 chance you're going to have Alzheimer's, is that still something you want? Now, the good news is there are a lot of things that you can do to protect yourself. Bad news is there's a lot of things that you can do that are going to lead you to an increased likelihood of having things like that. So let's go ahead and dive into what this research was, and then we can kind of go from there as far as what are the other things we need to watch for, and what can we do to protect ourselves. So this new research came out of, let's see, it was the University of Cambridge, it was King's College in London, and it was Liverpool, University of Liverpool is the other one that did the research. They collaborated on this. And what they found is those who were hospitalized for COVID 1 year to 18 months later, so 12 to 18 months after they were hospitalized, they had serious detrimental cognitive effects, including brain fog. And they compared what that damage was to how fast the aging was. And they showed that they aged 20 years in that time span. So just going into the hospital with COVID led to a 20-year increased aging on the brain. That's scary, right? Those that weren't hospitalized don't have to worry about this. So if you're thinking, I got COVID and I'm like terrified of it, that's not what we're looking at here. Those that were hospitalized had a 20-year increase in the aging of the brain. And that's something that's significant. What are other things that can cause damage? Any kind of trauma, right? If you have a car accident or fall and hit your head or anything like that, that can do it. Loss of mobility has a massive increase on the speed of breakdown in the brain. Loneliness. There are a lot of different things when we aren't getting that stimulation that we need. And this is something that we see in caregivers to those with Alzheimer's too, is we see an increase in the likelihood of mental illness and depression and different things like that, because it's a very, very difficult job. It's hard to watch somebody else going through that. So it all leaves the question of what can you do to protect yourself? And there are a lot of things that you could do to protect yourself. We're not going to dive into all of those. What we're going to strictly focus on are what are the metabolic things and what are the brain things that you can do, right? We're not going to dive into vaccines. We're not going to dive into supplementation. We're not going to dive into all of that stuff. That's stuff that other people can cover, and they do a fine job with it. What I want to focus on is what can we do to improve our hardware? What can we do to improve our software? What can we do to increase the brain and the body's optimization? What can we do to optimize our energetic function? So first things first, what can you do to build this up? We have to get back to the foundational levels, right? We cannot start right where we're at. We cannot wait until diagnosis to actually do these things. We have to plan ahead. Now, when you look at Alzheimer's disease, they say it starts anywhere from 30 to 50 years before diagnosis. That's scary, right? Because that means if you're 85 years old, it really started perhaps as early as when you were 35 years old. If you're 70 years old and you had it, it might have started when you were 20 years old. So what correlates with this? When we look at Alzheimer's, we have an increased risk of those with poor stress handling. We see an increased risk of those with mental health challenges. We see all sorts of these things, like trauma adds up. So the more concussions you have, the more likely you are to have those outcomes. So being able to protect the function of your brain is first and foremost one of the best things you can do. Now, I see a lot of people that come into my office and they have issues with their balance, they have issues with their eye movements. Those are things that we check on every single patient that walks through the door, and most people are totally oblivious to this. They have no idea that it's there. Why? Because the functionality of everything else allows them to overcome this, right? They can still stand, and the muscular function can override that balance control. They can still read, and so they don't know that when they turn and quickly look at something, their eyes aren't making it over to the target, and they miss it. You've heard the stories of people pulling out in front of people, and they're like, I looked and nobody was there. That's what happens. Their eyes don't make it all the way over to that target. They didn't see them because their eyes couldn't go all the way over there. That is a lack of eye movement. These are also very, very common in people with learning disorders, people with mental health challenges, people with autoimmunity. All of these different things are all correlated with those things. We see an increase in any kind of neurodegenerative or neurodevelopmental issues. We see changes in the vestibular system. We see changes in the eye movements. We see changes in all of these other coordinated functions. So when we can get evaluated and know what our function is, that's a great place to start. The good news is, if you do have some sort of detriment in your function, we can stimulate that to help bring it back. So knowing what your deficit is and being able to provide the proper stimulation is massively important to the quality of brain tissue that you have. And just like a building, if you build a really, really solid building, it's harder for it to fall down later on, right? You just have to maintain it from there. So you can't have any traumas or different things like that. If you do have a trauma, you have to repair that area to expect to keep that function. So what are the other building blocks that go into this? Diet. Your diet is very, very important to your brain health. And a lot of people don't realize this. And one of the arguments out there is veganism is very healthy, right? But it's not necessarily healthy if you're trying to fix your brain, because you have to have the protein, you have to have the healthy fats that are difficult to get in that diet. The DHA, the EPA are things that come from animal sources, and they're necessary to build the myelin around the brain. Those come from a Mediterranean diet. So adding fish or adding broth or different things like that can be things that are beneficial to help build those tissues up. But doing crosswords alone is probably not going to do it, right? So we've got to have multiple different steps here. We can't just focus on diet. We also have to focus on exercise. What kind of exercise is going to be good? It doesn't matter. In all honesty, there's a variety of exercises that are going to be beneficial for you. You can do intense exercises. You can do the aerobic exercise that you're doing for an extended period of time. You could do quote unquote zone 2 training or whatever you want to call it. You can do sports, whatever. What I'm going to tell you is the more varied you get in this, the better results you're going to have. Because when you have a variety of different types of motion and a variety of different ranges of motion, you're going to stimulate a variety of different neurons and networks in the brain. When we have more networks stimulated, it's use it or lose it, right? That's what the brain is. That's kind of where that came from, is use it or lose it. If you don't use those skills, they start to go away. So when you have that varied range of motion, you stimulate a variety of things in the brain, you start to get better overall function, and the more of those networks that you can stimulate, the more that you're going to build, right? So it's not just crosswords, it's not just, eye exercises, it's not just, you have to have a variety of different things. And when we can put enough of those different things together, we get the outcomes that we want. And the other thing about exercise is it's not just the stimulation of the brain that you get, you also increase blood flow, and that blood flow is massively important for cleaning things out. It's massively important for oxygenating things and helping to grow and repair and heal everything that goes on up there too. Final thing we're going to talk about is sleep. Sleep is very, very important in recovery, and a lot of people take this for granted, right? It's kind of the badge of honor to work 80 hours a week. It's the badge of honor to be able to pound through and suffer more than somebody else. As in our society, it's something that's celebrated. But we need that rest and relaxation. That's when we get the body, ultimately during sleep, a couple of things happen. That's when memories are formed, right? It's when the hypothalamus starts vibrating back and forth. And when you have those back and forth patterns, that's where memories are actually formed. So that's when you learn, that's when you grow, that's when you repair. But it is actually like repairing is a huge part of this. At night, what happens is our blood flow increases in the head, and it helps to flush some of that junk out. We get some of the toxicity out. We get some of those neurofibrillary tangles out, the proteins that get deposited in some of these demented type of disorders, the Parkinson's, Alzheimer's, non-Alzheimer's type dementia. I mean, there's a few different things that those get deposited, but when we can get in and clean those junks out, that's super, super important for actually making progress and having the brain health take that next step forward. So again, just to recap, what this study showed is your brain can age 20 years if you are hospitalized for COVID. We're not going to dive into the other aspects of this, but protect yourself. When you have better, brain function, you have better immune function. When you have better brain function, you have better metabolic function, right? When you're up and you're moving, and all of these things are going to cover the main things. They cover the metabolism, they cover the neurological function, they cover the immune system, they cover the cardiovascular system. We have to have a blood supply to actually run everything, right? So all of these different things are stimulated when we get the diet right, when we get the exercise right, when we get the sleep right, and when we have the brain developed in the way that it should be. So protect yourself, but start early, because these things don't happen when you get a diagnosis. In actuality, they're starting 20, 30, 40, even 50 years before you get the diagnosis. So is it too late to start? Absolutely not. There's studies that show that no matter what type of exercise you're doing, starting at 85 years old can show you benefit to it. So don't be worried about where you're currently at. Be worried about where you want to go. What are the actions that are going to help you get there? So as always, I really, really appreciate your attention. If you found this interesting or useful, please like and subscribe. It gives me a lot of good information as far as, what type of things I need to share, what you're going to get the most value from. And, like I said, I appreciate you being here. I appreciate your attention, and I can't wait to see you on next week's video.